Now, I usually have two categories when I see somebody with lower back problems. The first category would be the person with stenosis, and the second category would be patients who have herniated, bulging, or protruding discs. Now, both types of patients might feel radiating symptoms. Starts with lower back pain, radiates maybe into the hip, or down one leg, down the other leg, or down both legs. Now, the rule of thumb is if I'm seeing somebody with a bulging disc or a herniated disc, they will usually feel relief with extension type activities, which is standing up tall or extending back. The people who have spinal stenosis usually feel relief with any type of bending or forward flexion activities. Now, all the lower back rehabilitation exercises that are in this video can be used for either condition, but you want to keep that rule in mind that usually people with stenosis, they tolerate flexion better. People with herniated discs or bulging discs tolerate extension better. So you should progress your client according to those rules. If any of the exercises cause pain, first make sure that they're doing the exercise properly. If it still causes pain, then that might not be an appropriate exercise for that client. Now, with the radiating symptoms, there are two things you should be aware of. Centralization of symptoms means that you're seeing somebody, they have pain in their back and in their leg. Centralization would be your goal for that person. And centralization basically means that you are centralizing the symptoms into the lower back. So if they have, let's say, a 8 out of 10 pain, which is pretty severe, all the way down their leg, you want it to become less painful in the leg, even if it becomes more painful in the lower back. Now, the opposite of centralization is peripheralization, which means obviously the pain goes into the periphery more. You do not want to peripheralize pain. So if there's an activity or an exercise that you're doing and it creates more noticeable symptoms further down the leg, you need to stop that activity quickly. Your goal is to centralize, and the thought is your lower back is a window. You want the pain or the symptoms to come up your leg and out the window. That's your goal. That's your centralization. Now, with a herniated disc, like I explained earlier, the herniated or the bulging disc usually responds better to extension activities, and stenosis responds better with flexion. When you have somebody that has stenosis or herniation, you want to start them off with repeated motions. So for stenosis, you would have them do repeated flexion. They would sit in a chair and just flex their body repeatedly, 10, 15 times, and then you want to assess what their symptoms are at that point. You're hoping that they are centralized. With the herniated or the bulging disc patient, you also want to do repeated motions, but it's more of extension repeated motions. So you'll have them stand up, and they will do repeated trunk extension, like that, where they're extending their spine. You want this to centralize their symptoms also. So have them do 10 or 15 and see what happens with their peripheral symptoms. You want it to centralize. So you can do the stenosis repeated flexion in seated, or you can do it standing up 10, 15 times. For the herniated and bulging disc, you can do it standing. You can also do it on your stomach, where you prop up into repeated trunk extension, kind of like a cobra stretch, 10 or 15 times, and see what happens with that. Now, if you know which way your disc is herniated, as I said earlier, they're usually posterior or lateral, back into the left or back into the right. If the disc is herniated or protruding back into the left, you want to do your extensions, but you also want to do a diagonal towards that side. So if it's herniated left, you are going to extend back into the left on a diagonal. If it's herniated right, back into the right. And again, you could do that standing, or you can do it on your stomach. This would be straight extension. Now if you side bend slightly, this would be extension left. If you side bend to the right, that would be repeated extension to the right. And then reassess your symptoms and see if you have peripheralized or centralized. Again, hopefully you have centralized. The other thing you want to look at is what's called a lateral shift. And most of the time, somebody with a herniated disc will present this way. Lateral shift, basically, here's my upright posture. My shift to the left would look like this. So my entire trunk is side gliding on my pelvis. It's not a side bend, it's shifting that way. So that's a lateral shift to the left. This would be a lateral shift to the right. Your initial goal is to correct that lateral shift. So that's the first thing you want to do.